So hearing shapes the way we communicate and connect with the world, yet constant noise and everyday listening habits may be affecting it without us realizing. To understand when should become harmful and how we can protect our hearing, we welcome Dr. Marwan Alqenaei, Senior ENT Specialist. Good morning, Doctor. Welcome to Good Morning Kuwait.
Good morning. It's a pleasure to be here with you.
Pleasure for us too. So first of all, Doctor, our relationship with sounds begins before birth, long before we see the world around us. From a medical perspective, what makes hearing such a remarkable sense, and how does it shape the way we connect the world throughout our lives?
Okay, so a very nice introduction in the video that we just saw. So actually, hearing though, the hearing system develops early in pregnancy, like during the early fetal life, as early as 4 to 5 weeks. It continues developing until, let's say, 16 to 24 weeks of gestation. And during this period where the baby really starts to hear, okay, or hear some sounds and gets familiar with the noise. So it starts really early and continues develops actually even soon after birth. And this gives us something, you know, and a lot of babies, newborn babies, get familiar with their mother's tone or just becomes quiet when they hear their mother's voice. It's because they've been hearing it throughout the pregnancy, okay? And that's something very interesting, and it helped us understand more about how hearing develops. So yes, it's one of the most important senses. It develops even after eyesight in children, and it affects our everyday communication, life, and that's why we really have to protect it.
Exactly, Doctor. We are surrounded by more sounds than ever, from traffic and the crowded places to entertainment and, of course, personal devices. At what point does everyday noise become harmful to our ears?
All right, so that's a very interesting question, especially now in the era where everyone is using headphones. You know, it's been part of our everyday life, especially within commuters, within specific jobs, and it's not only headphones. There's something called occupational hazards of sound. So a lot of people work in a noisy environment. Okay, some even media personnel also always use headphones. We have people who work, let's say, in airports, around construction, machinery. So they also have to pay attention that throughout their life they might be exposed to loud noises that can damage their hearing. So back to your question, what are the things that we can do to help and protect our hearing senses? It's not only how loud the noise is, it's about the duration of exposure. Okay, so these are the two important factors. It's not about how loud you hear, it's also about how long you use. So I always recommend people who are around like headphones or construction to take what they call breaks, you know, breaks during their time at getting exposed, not to, of course, increase the volume of the device itself. And there are also other methods that we're going to talk about later on.
Doctor, you've mentioned the breaks. Does the breaks really help?
It does, it does. So there are a lot of institutions and guidelines that have been made and studied the effect of hearing on or the loud noise on the hearing of people. So let's first talk about how is loudness or how is noise measured. It's measured in units called decibels. Okay, decibels. So the louder the decibel, of course, the higher the sound. And the permitted loudness that any person can have during a day is 8 hours of 80 decibels. Just remember, 80 decibels, 8 hours. More than that, they are risking the damage on the noise. And I always say, like, the higher the decibels or the loudness is, the shorter the exposure should be. And yes, all studies have determined that's not only how loud the noise is, it's about how long you're exposed to it throughout your life.
Dr. Marwan, headphones, earbuds, and is there a difference between the Bluetooth ones and the wired ones? So is there one better than other?
Okay, so there are two components now here. Okay, it's actually the device itself on its effect of the ear, the external canal, and the effect of the noise on the hearing. Since we're talking about hearing today, let's focus on how much noise we're exposed to. Okay, they're both exposed to the same amount of noise to the hearing system. However, there are some features in those headphones that help us not to increase the volume. For example, there's noise cancellation forms or headphones that can help. So the noise cancellation itself does not protect the hearing. However, it makes us less inclined to increase the volume. Okay, so when there's a noise cancellation with the option, just turn it on, as you will not be forced to increase the volume in, let's say, a noisy environment.
Speaking about occasions, loud music, weddings, Dr. Marwan, we experience after that, some of us actually, ringing or muffled hearing. Are these temporary reactions, or could they be warning signs of an actual thing?
Actually, it could be a warning sign, since you mentioned it. Very rapid or fast exposure to the ear, and then you're hearing tinnitus or the ringing or the muffled noise, you need to see your doctor, because there could be something damaging the hair cells in your inner ear and causing some nerve damage and hearing loss. So this has to be seen by a specialist to determine the effect of the loud noise exposure on the hearing, and if it's a permanent or a temporary thing, because there are some treatments that we can give early on.
As it's common, doctor, there is a relationship between hearing loss and getting older. Is there any other factor rather than aging itself?
So aging is one of the diagnoses. So when a patient presents to us with hearing loss, okay, we have to diagnose. We have to do a specific hearing test, and there are certain patterns and graphs on the hearing test that we determine after that what's the cause of the hearing. So age-related hearing loss or presbyacusis is one of the causes. However, as we said, noise exposure, loud noise exposure, another. Genetics is another cause, as there are some medications that could affect the hearing, of course, and other than that, there's also some medical conditions that can contribute to hearing loss that we should be aware of. So it's a multiple factors that can contribute to hearing loss.
Hearing damage, doctor, can happen gradually. Can our hearing be affected without us realizing it?
It's one of the hidden symptoms, actually. Patients usually present to us, say, Doctor, during the last few months, I've realized my hearing is not as good, or someone pointed out that I've been raising my voice, or if I'm sitting in a group or within a group of people, there are a lot of surrounding disturbances. I cannot hear the person talking to me. So these are the subtle signs that can point out to hearing loss, but it's not something that patients really report or go to the doctor immediately after realizing, because it takes a long time to realize it. Yes, it is a hidden symptom.
How can hearing test detect the problem, doctor?
Oh, actually, it's a test that's done in specialized centers. The patient usually sits in an isolated soundproof booth, and then we apply some frequencies and sounds that the patient should respond accurately to, and then we determine, and it's plotted against a graph, and depending on that graph there is a mild, moderate, severe hearing loss, types of hearing loss, because there are multiple types of hearing loss, whether it's the nerve or the middle ear problems. So there are a lot of details that the specialized doctor will talk to the patient with, and to determine the exact cause and the treatment plan also.
Exactly. Doctor, we cannot avoid noise completely, or we cannot use headphones at all. So what's the, let's say, real solution, or something common and reasonable we can accept?
All right, so this has been studied extensively. There are multiple studies that looked at that. So there's the WHO guidelines, actually, which suggests, all right, and recommends that we do not increase the volume on our devices up to 60% of the maximum. Okay, so that's a very important point. Do not increase your volume up to 60% of the maximum. And again, I repeat, the sound cancellation option. It really helps us to avoid increasing the volume on our devices. And it's a very common thing that we see, like for gym goers or people who in a noisy environment. Doctor, it's very noisy around us, so I had to increase my hearing device, and then I started hearing muffled noise or hearing and get damaged. So it's very important to use all the technology available, but not increase the volume on our devices.
So using the technology in protecting way.
Exactly.
When it comes to hearing loss, doctor, or hearing damage may not always be reversible. So when people should understand today about protecting their hearing before the damage becomes permanent?
Actually, what we're doing right now, it's informing people about the dangers of
awareness.
And awareness is very important from all doctors. There's also some dedicated days throughout the year where we point out and do awareness campaigns regarding protecting the hearing. All personnel who work in a noisy environment, whether it's the construction, whether it's in oil, or the airports, the machinery, surrounded by machinery, media, we need to be aware that there are some protective devices that can be worn and should actually be given to the employees to protect their hearing.
Of course, Dr. Marwan, thank you for joining us here in Good Morning Kuwait.
Thank you so much. Pleasure to be here.
Thank you. Now, of course, joined us by Dr. Marwan, and he showed us that how can we protect our hearing and preserve this. So, and just as we protect our senses that can connect us to life, we must also preserve the places that can connect a nation to its past. Our next report takes us to Al-Jahra, where the Red Palace still stands as a witness Kuwait's history, resilience, and, of course, identity. Let's take a look.